The way we build our health esteem is by taking care of ourselves and don't deny or push away symptoms of fatigue or, hair loss, restless legs, things that are new or different for you.
Yeah.
You want to have access to your health information in labs. But if your ferritin is not in the red level, if it's not below 15, you're not near the disease of anemia, so there's no action taken. Bryn, we've got this product, this FERAPRO. Have you tried it? And thought, oh no, I haven't. And I don't think I said it, but in the past I thought I've tried iron supplements and they were horrible. But lo and behold, literally, I started prescribing it and patients were getting results.
Hi, everyone, and welcome back to Walk with Wisdom, a lifestyle show on youthful aging, which is looking good and feeling amazing as we age. Today, we have the amazing Dr. Bryn Hyndman, MD. Dr. Bryn, thank you so much for joining us on Walk with Wisdom today.
Thank you for having me. It's a pleasure.
Fantastic. Now, Dr. Bryn, I am just going to go right into who you are. And ladies, we've talked about this. Sometimes the best person to tell us who they are is the person and the guest themselves. So, Dr. Bryn, your background is fascinating, starting as a naturopathic doctor decades ago and later earning your MD designation. Then you blended Eastern and Western paradigms. I also love the way on your website that you say you support women, and you mention that your work is really about building something that you call health esteem. Could you share what you mean and why it matters?
Yeah, certainly. So as a woman and a doctor, I realized midway through my career how easy it is to take care of others before taking care of ourselves.
Yep.
And so the way we build our health esteem is by taking care of ourselves. And part of that is, yes, we need to make time and not put ourselves on the back burner. But we also need to know our needs and what works for us. And one size doesn't fit all in health and wellness. And I think there's so much information out there from just a lot online with social media and influencers and experts. And it's not wrong or negative, but I've certainly seen women who are confused because they will try something for their health, but it doesn't work for them. So I'm really passionate about helping women learn and empower themselves and become confident in the knowledge of what their bodies need, and to make sure they take care of themselves as a way so that they can really show up fully from a place of love and abundance for others.
Right. Dr. Bryn, I love that. And you are talking definitely to us girls. I know the listening and viewing audience, primarily ladies, know that because we do take care. We're caregivers by
Yes.
nature, and we take care of everybody else, but not ourselves. And so health esteem, I'm not done with that yet, Dr. Bryn, because you gave an excellent example as to what that means. But did you get that from self-esteem to being more yourself is really your health as a whole? Is that what I'm getting?
It's a great question. I was actually in a coaching session with a long-term mentor,
Yes.
and I just blurted out in my just
Yeah.
saying where I was at and my hurdles. And I said to him, I feel like I have low health esteem.
Wow.
And I kept talking, but he paused and he said, this is really interesting. What do you mean? And I said, well, I've got self-esteem in what I'm doing and in my role in life. But for my health and my body, I'm not feeling confident. And then we traced it back through the fact that I really wasn't taking care of myself. And so how could I feel good about my body if I actually wasn't taking care of it? And for many of us, I think it can be easy to attune to other people very readily.
Yes.
And if we do that enough, we forget to attune to ourselves.
Yes.
And if we ignore our needs long enough, then we don't even know what they are. And if we're not used to receiving and, not having too much pride to say, I need some help or support, then we end up feeling really burnt out and resentful, and we're not able to feel gratitude.
Right.
Because I read somewhere that to feel gratitude, we have to be able to receive. But again, as caregivers and helpers, often it comes so naturally to us to take care of other people. that we don't stop or pause to receive, or we might not be aware of all the goodness or something that someone wants to give us or a gesture. So it was this kind of unraveling of, okay, well, I don't want to have low health esteem.
Yes.
And then it was a theme in my work with patients and especially women.
Right. Thank you, Dr. Bryn, for going deeper and for allowing me to stay on that, because that is such a catchy subject. And I know, ladies, you get that. And I'm so grateful to have you on the show to help us bring up our health esteem. So, Dr. Bryn, I'm sure that becoming a mother and experiencing twins, which you have on your web. Okay, I didn't have biological children, but I always thought I'd have twins. And in my family, there are identical twins, fraternal twins, even a set of triplets all over the place. So,
Wow.
Parenting twins, how did that shape your view on women's health, energy, wellness in your practice? And can you really speak to us on your journey of really incorporating that in health esteem?
Well, it was chaotic, as I think a lot of parents would say, of the early years of having kids, from sleep-deprived evenings till then you have a toddler on the go and you've got to constantly chase them so they don't hurt themselves. And at some point, maybe around age 6 or 7, there was enough clarity to realize I was super exhausted, super tired. I hadn't taken myself. I actually didn't even have a doctor, I'm embarrassed to say. So I hadn't done blood work, and I did realize I'm also not the mom I want to be. I don't have patience. I'm not really compassionate and caring, and I'm just lying on the couch after work. It's like so tired. So then I realized this is not selfish. I've really got to learn to take care of myself to be the person I want to be and to be able to show up for others.
Right.
And then, of course, we're talking about iron deficiency anemia today throughout a span of a woman's life, but certainly postpartum is a time when our iron stores can dip, but then also breastfeeding takes a lot of minerals, not just iron.
Of
but
course.
Iron, I tell so many women this because it's so common. Iron is the most common worldwide mineral deficiency there is. So, I think a lot of women can be in this situation where their children are 5, 6, or 7, but they haven't done, since their postpartum years, they haven't done blood work, or they're unsure what can be contributing factors. And sometimes it's a contributing factor, iron deficiency anemia, it's not the main cause. Other times it is the main cause. But I don't know a mom with young kids who also is involved in the community or works outside the home who hasn't had moments of fatigue and overwhelm and burnout. So that was a long-winded way to say, I think it just got my attention loudly enough. Sometimes we say things whisper, and then certain things wake us up. Like, oh, I'm exhausted and raising my voice a lot of the time because I just can't cope. And I don't want to, I don't want to be that person.
Right. Thank you for that. And Dr. Bryn, you said something that's really unique. And, ladies, as Dr. Bryn mentioned, it's like an iron trifecta with 3 different experts, you being absolutely at the fulcrum, because being a naturopathic doctor, medical doctor, and seeing that cross-section of patients. However, you pointed out something that we haven't talked about before, and it's really women in the postpartum years. So we talk about women and their iron needs, and we'll talk about all the different groups, but we usually talk about women when they're pregnant. And thank you for bringing that up for ladies, which is why you are such an expert in what you do, because I think that's really a missing link. I'm in integrative health, so I'm on both sides, from pharmaceutical to nutraceutical. Talked about iron for over 2.5 decades, but I didn't really put together a missing group is postpartum, and how many of us women have had children and then you white knuckle it through the years of iron deficiency. Now you have a health esteem issue.
Yes.
I love that. And I see why that is such an amazing catchphrase. Now, what do you do for women? Let's just talk about that group of postpartum. What are some of the symptoms that a woman would be going through if she just had a baby? All the things, or 2 in your case. Oh my goodness, so double whammy. And now, what are some of the symptoms that might be a trigger, that it's not just, you're a mom, you're just tired, that it could be your iron?
Well, these symptoms, I have to say, for any woman, age in her 20s or beyond, they can seem nonspecific or vague.
Yes.
They could be attributable to so many things, but it is a simple blood test to help determine what our iron stores are. Going back to the symptoms, so fatigue, a lack of exercise tolerance, meaning things that used to be a workout for you, just you feel exhausted or you can't get up the energy to do it. Hair loss, maybe a bit of breathlessness where you wouldn't normally feel breathless climbing a bunch of stairs. Kind of just lassitude and brain fog, can't think clearly.
Wow.
You wake up after what should be a good night's sleep, but you're not rested. You feel like you can't get ahead of the curve or feel rested.
Right.
And then also just overwhelmed because of this constant fatigue. We're getting more and more behind, right? Like we can't, domestic
catch
stuff,
up.
taking care, you can't catch up.
Right.
So for these symptoms, of course, in postpartum, and I should say mood, of course, lowered mood,
yes.
depression, or even anxiety. And palpitations can happen with anemia or being close to that. So that can be a double-edged sword. It can make us feel anxious if we're feeling palpitations.
Yeah, of course.
Okay, is this now a heart condition? So it can fuel, anxiety, mental health, depression.
Wow. No, that's excellent. And how often, and Dr. Bryn, just being in your practice, and something again that you said, which is a really great sentence, is that a lot of these symptoms can be many different things.
Yes.
It's not just one causal factor. So there are many different contributing factors. So how do we rule out iron if a woman comes to you or they're listening today and they're having those symptoms? And we're going to talk about all the different groups because it's really across our lifespan for us girls, iron could be an issue. But how would you suggest that a woman actually rule it out? How does she know that's what it is?
I always order ferritin along with a complete blood panel. So the test is called a ferritin blood test, and that's the storage form of iron.
Okay.
So the ferritin number tells us, how much iron is the body storing? And the lower the number is, the less iron.
Right.
The difference with iron deficiency anemia is based on that ferritin number. Blanket anemia, like when we hear, someone has anemia, that's when our hemoglobin, which essentially it's the protein that carries oxygen, that is the furthest consequence. Then our hemoglobin starts to go down. So ferritin is an inexpensive test and it can tell us about our iron stores. But what's important to know about ferritin is it's also an acute phase reactant. That's just a really fancy name for saying if you have an infection, if you have inflammation, your ferritin can go sky high. I've seen it in 300, 400. I've seen it 1,100.
Wow.
During infection or inflammation. This is more in my elderly patients, but I've also seen it in women in their 40s or men. So ferritin has a lot of information, and one number is not the only time. We don't want to just test once as well. You want to see a trend over time. But what I will say, the difference between a functional medicine approach and the conventional medicine is in conventional medicine, you have to remember the origins of conventional medicine. It was literally, we had to learn how to save lives. And 200, 100 years ago, people were presenting with more life-threatening conditions.
Yes.
Infections, then we developed antibiotics. So these chronic conditions that, so to speak, are not life-threatening, but really impacting our chronic health, they're not necessarily flagged in a doctor's office on your blood work, if that makes sense. So your ferritin might be low, it might be 30 or 25, but that doesn't fall within the flagged red zone of being below 15. So you won't necessarily get a call back from your doctor's office. Now, I tell everyone to be their own advocate of their health. So you want to be able to download and access your blood work and understand, you can look at that ferritin number.
Right.
Because you could be low on your way to deficient, but not yet deficient. So it could be a cause for your fatigue and all these other symptoms, but you're not necessarily going to get a phone call back from a doctor's office because in Western medicine, we're trained, we usually don't treat it until it's anemia, until that hemoglobin's going down, or when your ferritin's below 15 or maybe even 10, when it's in the quote-unquote red zone.
Right.
Because really in medicine, we're trained to look for diseases and problems, and then we can help you. And as you know, if we do your annual blood work and we say, okay, well, blood sugar's good, cholesterol's good, nothing's popping up, be healthy, exercise, eat well, keep your stress down. Like, sure, that's all good. But if the ferritin is not at a super deficient red level, you might not know unless you check your own blood work.
Wow. No,
Or
makes sense.
depending on who you go to.
Of course, Dr. Bryn. Thank you. And again, very, very well explained, because allopathic medicine, Western, is certainly the disease model. And one of the things, my being an integrative medicine, which I love, is really the preventative side. So we're actually having experts like yourself read into the numbers before they actually get to a disease level. What is the body telling us? Because the body tells us before we get there. Right? So thank you for that. Now,
there's something, actually want to go back to a second part because you asked a really good question.
Yes, of course.
How does a woman know if these non-specific symptoms of fatigue, brain fog, hair loss, emotional ability, overwhelm, I mean, these can happen in perimenopause, menopause. How do we know if it's because we're iron deficient, our iron levels, or what else is going on in our body? But that is also where health esteem comes in, is being able to really check in and know our bodies. So if you are diagnosed with a low ferritin, let's say you're at 10 or 15, and now we know we need to supplement, you want to track how you're feeling as you're supplementing. Now, this is another story because you need a good supplement.
Yes.
And then check in, how do you feel when you retest? It's usually 3 months later.
Yes.
And you want to see, oh, okay, so I've gone from a 10 or a 15. Okay, I've gone up to 50 or maybe a 70. We like it at 70 or 80. So my ferritin's at a healthy level. What's different for me? But that requires mindfulness, right? For ourselves and our bodies. Oh, how do I feel when I exercise? I'm even getting to the gym. Am I still waking up in the morning like not rested even though I've slept 8 hours?
Right.
Fatigue, what's my level in the day? Or can I tolerate colder temperatures better? I mean, there's so many things, but that's a really key part of health esteem for me, is for all of us being able to check in and know, like, oh yeah, how is my body feeling? How is it reacting to that? Because we never just chase a number. It's the same with hormone testing. We can't just look at a blood test and say, well, your number of your ferritin is this, so therefore you should be feeling like this.
Yes, exactly. No, I love that. And you know, ladies, I know you will get this with what Dr. Bryn has said, is you tell us to check in with how we feel. And we have that. We can do that. So of course, we use the numbers because the numbers are going to give us specifics. But then there is so much more, which is where health esteem comes in. It's really the whole picture as to what's going on with each woman individually.
Yes.
And I love how you put that in that context, Dr. Bryn. Thank you for that. Now, you said something really about, of course, Western and Eastern, and the blending of Western and Eastern medicine for you. How did that come about for you in your practice, this blending of Western and Eastern?
Well, not by design. Like, I think for a lot of us, our life
like
plans,
life.
we don't plan them out. But
Yes.
I had a year off after my university, after my undergraduate degree. I had 1 year off. And actually in that year, I went to a naturopathic doctor, and I had IBS. I was overweight from university, and I just felt gross in my body. It was transformative. So I thought, I want to be a naturopathic doctor. But what I didn't realize is after I graduated, I worked for about a year and a half, but I realized I'd let a dream die, and I'd actually always wanted to be a medical doctor. But I knew my marks were not competitive enough after undergrad, and I just kind of buried it. But then I truly had a transformational shift, and I thought, this is incredible. I want to help others do this. So I realized at age 28, well, I want to have a family as well. I know that, and I didn't have this plan. So I've got to make a beeline and get my medical degree. Otherwise, I'm going to regret it my whole life, my whole career.
Wow.
So I had a really supportive husband, and it was actually, I was frustrated, and he paused one day and said, why don't you get your medical degree? Why don't you just become a medical doctor? And I looked at him and I said, well, I can't do that. And he looked at me and he said, why can't you do that? And, you know, sometimes you just need someone else to believe in you in a way. And I thought, okay, like he believed in me. So the long and the short of it is, I was on a mission just to get my degree and practice family medicine. But I knew I've always had a holistic model as the foundation and my lens of how I see the body and health. And I always like to say we can draw on the best of both.
Of course. Of
And
course.
again, in Western medicine, it was really designed as a life-saving system, and we're really
Yes.
good at trauma and life-saving, and even making some diseases chronic that we can live with for a long time. I mean, incredible. But we're now seeing a real pickup in this movement of how much we can elevate our health esteem by educating ourselves. And there's so
Absolutely.
much information out there, and it's not a one-size-fits-all. And advocating for ourselves or having someone advocate for us if we need that.
Absolutely. No, that's phenomenal. Thank you for explaining that as to how you got there. And life happens. And when you say it's not a one size fits all, that's so true. I was mentioning to you, we were talking, and I said, I like to say I wanted to be a psychologist.
Yeah.
So I went back to school in my late 30s. And one thing I learned with all the studies we were doing and the bell curve and how, things fall along the bell curve, and 10% in general of us, on one end, oh, this thing is fantastic, like a supplement.
Yeah.
Fantastic. It's my savior. The other 10%, that was a scam. I want my money back. And the rest of us is somewhere along the 80% of the bell curve. And that's why you're doing that blending is phenomenal, and explaining to women about our health esteem, because we are
Oh my
somewhere along
goodness.
that bell curve.
And it's, you never know. But like I can start, sometimes we do have to start statins, and most of the time my patients don't ever want to take them, but sometimes it's necessary. Sometimes someone's legs will swell in a second, or from a blood pressure medication, or a supplement. There's these unknown symptoms,
Yes.
and it's totally individual.
Yes.
However, because we're talking about iron deficiency anemia,
Yes.
what I will say is it can go untreated even if you know you have low ferritin, and I've been in this boat before, because a lot of iron supplements are so yucky and hard to tolerate that we just don't take them.
Yep.
I've been there, and I have patients, and I met women who just say, well, I'm not taking it because either it hurts my stomach or it makes me constipated. Like, it's horrible.
Yes.
And so myself, that is why I use FERAPRO and why I recommend it. And I say, no, it doesn't have to be that way. Iron supplements have come a long way since, they have been around for almost 100 years. Like, it's not new medicine.
Of course.
But I have to say, one size doesn't fit all, but there's really good compliance with FERAPRO, and I see the numbers come up. Of course,
Excellent.
the key thing to mention is we usually say supplement for 3 months and then retest.
Mhm.
So this is across the board for a lot of things, for people listening who might be testing their vitamin D.
Yes.
Or even if they want to see if their cholesterol or hemoglobin A1C is shifting. And of course, ferritin, just remember 3 months. Like, that's the marker. We wait
the
3
marker,
months.
Yes.
But I do use the FERAPRO supplement, and I swear by it, and I rave about it because it actually works and it's comfortable. It doesn't cause digestive disturbance.
Right, exactly.
Well.
Exactly. And Dr. Bryn, thank you for bringing up FERAPRO, because we are talking about iron today for us women, and because it's not really discussed that much. We talk about, our digestive issues. We talk about hormones in general. But talking about iron, especially with an expert like yourself, is why we're doing this, to really have a little education piece. So for those ladies tuning in, or the men who love the women, from daughters to wives, going, I wonder if it's your iron, honey. Have you checked your iron? So let's actually talk about supplements now that you've brought up the FERAPRO. So there's a myriad of iron supplements out there. And in general, two of the major concerns that women have in general, digestive upset and constipation. How is FERAPRO different from the myriad of other iron supplements?
Well, the iron type is called ferrous fumarate.
Yes.
And I believe that is why it is gentler on the stomach.
Yes.
A few other things FERAPRO has in the other cofactors that red blood cells and iron need to make hemoglobin. So it makes our lives simpler and more efficient. I don't know what woman doesn't want that.
Of course.
So instead of adding on your B12 and methylfolate, a type of folate, we don't have to take multiple capsules.
Yes.
And vitamin C, we've all heard, vitamin C increases the absorption of iron. Well, it's already in there.
Yes.
So that makes it really simple. But then also, we were talking about really fitting a person's approach and lifestyle. Iron is best taken on an empty stomach to get the best absorption. And I don't know about you, but I want the best of everything. So if I need to get my iron up, I want it on an empty stomach.
Yes, of course.
So it's about getting creative. You can take it before bed. However, then you wouldn't take it with magnesium because technically magnesium's a mineral. It could bind the magnesium.
Of course.
Sometimes some women I know take it in the middle of the night. If we know, like myself, I'm going to be up to pee once a night. I've had kids.
That's
so
a great
isn't that brilliant?
idea.
You're already
I
up.
never thought of
It's
that.
right on your bedside table where water is. You take it.
Wow.
Or you take it first, like literally it's on your bedside table. You take
Yes.
it first thing in the morning.
Yes,
So it has to be easy and doable.
of course.
And simplified. So those are all the reasons. And of course, FERAPRO comes in smaller dosages and you can work up.
Of
So
course.
especially if patients have had bad experiences or we don't want to overshoot because, of course, too much is inflammatory. I've talked about that. People can start with a lower dose.
Yes.
I say just start with a lower dose, see how you feel. Then you can double up if you feel good.
Absolutely. No, that is phenomenal. And Dr. Bryn, you've given us ladies amazing tidbits. And one of it is taking it on an empty stomach. Now, a lot of the iron supplements, they take it with food. However, so can you just go back to why you would suggest? And we're doing an iron. We're doing 3, and then we'll probably do 6 because iron is such a big picture, and then to specific groups of women.
Yes.
And thank you for being one of the experts here. But in general, the experts are saying take it on an empty stomach. Can you just go back to that and tell us why take it on an empty stomach is recommended when sometimes the bottles say
Yes.
take it with food?
Yes. Well, generally, recommendations to take with food
Yes.
can often be to minimize digestive upset or
Right.
nausea.
Right.
So I think if someone is ultra sensitive or if their past memories of all iron supplementation is they get nausea, which can be a side effect, they think, oh, I want to have it with some food. So without food means we maximize the absorption of the iron. So again, I always tell people and recovering perfectionists like myself, do not stress out. If you're taking iron with the food, that's totally fine.
Yes.
It's just that we think the absorption is higher. The absorption is higher if it is on an empty stomach.
Of course.
And you can tolerate it. Again, if I say to people, if you're more comfortable taking it with food, that's fine. And talking about food, I know it's really easy. You can Google or chat GPT sources of heme iron and non-heme iron.
Right.
And we do get iron from plant foods, but if you look and compare animal foods, we absorb the iron from animal-based products so much more readily when we eat it. So, of course, it's rare. I don't see that many women or men who are totally vegan. But if women or men are open to eating animal-based sources of iron, that can also help raise their iron.
Of course, of course. And thank you for that. When I started the podcast, and a lot of my valued listeners, thank you. And by the way, if you have further questions, you can definitely reach out to wisdom at walkwithwisdom.ca. Dr. Bryn Dr. Bryn, now is the time to actually talk about,
Sure.
There's a little bit of a change that you're doing in your practice, because I know ladies are going to be listening and going, how do I get a hold of her? So let's just jump in. We're going to go back to the different sources of iron and, heme versus non-heme and the absorption factor. But
Yes.
before we do that, what is going on with you? Where are you right now in your practice? How has life changed
That's a great
for you?
question.
Yes.
I'm very grateful for the practice I've built, and I have long-term lovely clients. But what I'm realizing is it feels like a bottleneck. As a doctor, there's always a limitation of how many patients I can talk to. And this information is entirely confidential. So it's a vault of sometimes really helpful information.
Right.
And sometimes I'll be trading information anonymously, but a patient will come to me and share a resource, a clinic, a supplement, a food, a program, any type of resource that has been a game changer for her. And then I'm sharing that information, of course, confidentially with the
Yes.
next patient.
Yes.
And I'm realizing we actually learn in community. And community and connection are key for longevity. We know that in the blue zones.
Of course.
Brain health, the strongest determinant is socialization and community.
Of course.
So I am creating a virtual platform where I'm creating a virtual community where I can impact so many more women than working one-on-one, but also we can actually all help and learn from each other.
Love
Because
it.
I've realized as a doctor, I actually learned so much from my patients. And I'm really passionate about community.
Yes.
So I still have my medical practice. I'm not taking new patients, but I'm really excited about building out an educational platform and sharing information and knowledge so that women can build their health esteem.
Oh, amazing,
yeah.
ladies. We heard it here, building our health esteem from Dr. Bryn Hyndman. And Dr. Bryn, obviously, as you build your platform out, that information will be on your website. Is that the best place to see it? Excellent. I just wanted to get that
Thank
out
you
there
so
because
much.
I know the ladies are going to go,
Yeah.
well, how do we talk to you specifically? And my culture is about community. And you hear about, it takes a community to raise a child, but it's
Yes.
also a community so for instance, when someone has a baby, everybody moves in. The aunts, the grandparents,
Love
the
it.
friend, and they take care of the mom. She does nothing except drink. It's called fish tea, which is mineral from fish. So you boil it down and then you put all the veggies in it and seaweed, and that just replenishes the body.
Nutrients and minerals.
Absolutely, and all that. So that's like a community there to help to rebuild women. And women, once we're strong, we of course can take care of the children and the men in the family and the community in general. So I really love that. And now where we are with internet, we will have more of Dr. Bryn. So this is excellent news. Now, Dr. Bryn, let's just go back about the iron. When I started this, again, life happened. I'm talking about youthful aging. I used to model when I was 13 up until I was in my 40s. And then in my 50s, when menopause hit, something bad happened. Come to find out, I have low iron and low ferritin. And so we'll talk about, that iron really it's low across the ages. But I always had low iron. So I thought, great, don't have your period. Now your iron is normal. Yeah. But so maybe we'll talk about that. That's not necessarily true. So if a woman has had low iron and you haven't taken care of the root cause, just because you're now in menopause, it doesn't mean that it goes up. You still have to be doing active things to increase your iron, correct?
That is a very good question. You always want to find out the cause of why your iron stores, also known as ferritin, is low.
And I've never been able to absorb iron. And so I started with FERAPRO and the cofactors, which is why I think that this is just something incredible. But I have to take the low dose because of constipation. So it could be some digestive issues, which I know is something that we'll talk about, Dr. Bryn, when we talk about iron with women. I love that you said it's your health esteem and how are you absorbing it? Because we're all different.
Yes. So going back to a really low ferritin.
Yes.
In a woman who is having regular periods, and almost any woman or teenager, let's say from age 15 until 50, the most common medical cause is blood loss through heavier periods.
Of course.
But there can be many other causes, low absorption, and there can be genetics. I've seen mothers and daughters and the mothers just said, I've had this lifelong. I eat meat. I'm not vegetarian. And we can't identify other causes. So things like H. pylori, that's the bacteria in our stomach that causes stomach ulcers.
Yes.
Inflammatory bowel disease, that could be Crohn's, colitis, or being celiac.
Yes.
Gluten sensitivity, taking antacids or proton pump inhibitors, that can impair iron absorption.
Yes.
Very rare but possible is a colon cancer, internal bleeding.
Yes.
And that's why we always check ferritin in men. I do, because it's much more of a red flag in men when ferritin's low, because of course we don't have the obvious blood loss.
Of course.
I will say, in your case, when you've had a super low number for a super low time, we're more likely to think of something chronic versus something sinister and acute, like a colon cancer.
Yes.
But certainly there can be many different causes, and it could be just poor absorption, or you could have some genetics at hand too.
Yes, absolutely.
So we all in medicine, yes, we always want to rule out the sinister and the aggressive.
Of course.
And then, and it doesn't mean it's not important. And of course, it impacts your quality of life. But there can be, serious causes of iron deficiency.
Of course.
Yeah.
And Dr. Bryn, I love what you say. I have been just very, very grateful to have studied under incredible people. And in the integrative model of pharmacy, a lot of the pharmacists that I was with, I studied under great pharmacists from the 70s. And one in particular, he'd always say, Genevieve, if you don't remember anything, ladies, and Dr. Bryn is now, of course, saying it, that it's not what you take, it's what you absorb. So coming back to iron and iron absorption, you mentioned a word called cofactors. And is it strictly the vitamin B and vitamin C? Is that what you mean by cofactors that's helping that iron be absorbed so that we can actually use it?
Yes. Yes. So vitamin C, ascorbic acid,
Yes.
traditionally has always been taught, or you might have heard, have vitamin C to help absorb
With
your iron.
yes.
So, or if you're having some animal iron, if you're having some beef, have some fresh citrus, or
Yes.
we hear about that for eating. So vitamin C increases absorption, but the cofactors, glycine and vitamin B12 and methylfolate, they help basically create the red blood cells. They help build the hemoglobin.
Amazing.
So they're part of the factory. They're part of the assembly
Right.
of carrying around oxygen in our body.
Yes.
And that's what we need iron for.
Excellent.
Builds the protein.
Excellent. So a symptom of just what you said about carrying around oxygen in our body, we hear about that oxygen, that's, life itself. Is it the oxygen carrying capacity that makes her fatigue, and it could be your iron, so she should check it? Is that a general
Yes.
test?
Yes, exactly.
Okay.
So when we talk about anemia,
Yes.
we're looking at what we call the hemoglobin.
Yes.
And hemoglobin is the molecule that carries the oxygen in our blood. However, iron deficiency starts first. So our hemoglobin can be within a healthy range. So it's not flagged red. It's not too low. But our iron stores can be low, can be starting to dwindle. And so it means we can start to feel the fatigue as we're having less iron to build the hemoglobin. It's like it hasn't shown up in the hemoglobin yet, but it's en route to.
Of course.
If that makes sense.
That totally makes sense. And ladies, Dr. Bryn, you're doing an incredible job at explaining it to the ladies, because that's why I love what we do in the podcast forum. It's school, but it's not school. It's like us girls just talking. We're having tea. I love tea. Now, I'm from the islands and we love tea, and I drink hot tea all year round. So it's like we're having a cup of tea and you're talking. Ladies, grab a cup of tea, listen to the podcast, listen to the other podcast, because Dr. Bryn has actually put everything that we've talked about iron so far in context. So make sure you go back to the other podcasts that we've done to put it all in context for you. Now, I have a specific question for you. So in your functional medicine lens, first of all, can you explain functional medicine to those who may not quite understand that term?
I love you asking that question because it was so vague to me. But think of functional medicine works when you have a condition that is causing you a low quality of life, but it is not a disease. So think of it as there is dysfunction, but there is not disease. So irritable bowel syndrome is a super easy example. So in irritable bowel syndrome, it's not life-threatening, it's not fun, but it's a symptom category. So you can have stomach pain, bloating, alternating constipation and diarrhea. Your digestive system is not working well and you're not comfortable and it's not a great quality of life. But it's dysfunctioning, it's not diseased.
Yes.
Okay, a disease would be colon cancer.
Yes.
Or an inflammatory bowel disease like colitis or Crohn's, which can have extreme pain and blood loss and other things. So a disease means there's a disease to treat and life-threatening serious symptoms. Dysfunction means you don't feel great and something in your body is not functioning well, but it's not life-threatening.
Okay.
Does that make
Excellent.
sense?
That makes total sense. And, I know the ladies are going to get that and get that difference. So thank you for explaining. So in that lens, in your functional medicine lens, how do you assess and interpret iron symptoms in women that might be dismissed in conventional settings?
That's a great question. I would say the symptoms might not be dismissed, so fatigue, brain fog,
Right.
Breathlessness, but a ferritin test might not be ordered.
Okay.
Depending. Now, usually with hair loss and fatigue, we usually always test thyroid and we always test iron, ferritin stores. But sometimes ferritin isn't tested, only hemoglobin is, just your CBC. You might have to ask for ferritin.
Yes.
But the part 2 on that, which is super common, and I think we touched on this, but if your ferritin is not in the red level, if it's not below 15, some provinces have changed, if it's not below 30, you're not near the disease of anemia.
Yes.
So there's no action taken.
Of course.
So I always suggest know how to access your own blood work. You know, in this day and age, it's your information.
Yes.
You check your ferritin, and you might need to be your own advocate and follow up. And again, the healthcare system is so crowded, and there's so much serious illness to address as well.
Yes.
So really know to have your ferritin checked. And if you're not in the red zone, if you're 30 or 40 or 50, that might be low enough for you to have these symptoms. And the only way to know is if you test, and then if you resupplement, and then if you retest. And check in with your body. Okay, how am I feeling?
Yes, exactly.
My ferritin was 30. I'm not in the red zone and I'm not fully anemic, but my ferritin was low and now I've supplemented. What's changed over these 3 months?
Exactly. No, that's excellent. Now, Dr. Bryn, for those of us who are in Canada, we're in beautiful Vancouver, Canada, everyone who's listening. And so for wherever you are, make sure you check to see what the numbers are where you are. However, this will be a great marker. Can you tell us what the numbers are? And I'm sure it's a range.
Ideal.
Yes. For ferritin and, for iron levels to be normal.
No, I'm really glad you asked that. So a few things. If you are under the weather, sick, or you have an infection, your ferritin might not be accurate, so you might want to retest. But number 2, between 70 to 80 is ideal for women.
Okay.
Up to 100. I don't like to see it over 100 in women or over 120 in men.
Oh.
And that's because ferritin can be inflammatory.
Of
and
course.
many women have the problem of too low ferritin.
Yes.
But we don't want it to be too high. And we never want to take iron without knowing our ferritin levels, because that can be inflammatory. It can drive inflammation if we don't need it. Or, if check your multivitamin that it's not added in there. You always want a number to know your ferritin. But ideally, I say 70 to 80. If it's a bit above, that's fine. But I don't like to see it much above 100.
Okay, excellent. Now, is that the only, and I know we're talking about numbers here, and when you talk about health esteem, it's so much more than just the number because you're looking at the whole person. However, the numbers matter because it at least gives you a foundation to start. So is ferritin the only iron number that a doctor looks at when you do a blood test?
So ferritin is the first test. Then depending on how low your ferritin is, and then what your MCV is. So that's your mean cell volume.
Yes.
And
I've
a
seen
small
that.
number, like
Yes.
below 80. It means your red blood cells are really tiny
Yes.
and kind of shrunken and pale because there's not iron in them.
Yes.
So MCV is another number to look at. And then the iron test in your blood, it's confusing. It's not a direct reflection of iron stores, but iron can be helpful, and then the total iron binding capacity and the transferrin saturation. So essentially, we have these proteins in our blood that drive around the iron. Okay, so
Right.
when the body is struggling and saying, we need more iron, it shoots all of those transport proteins up. It's like, we need more iron, and so we need more transport. We're going to get all the
Yes.
transports around.
Yes.
So these other numbers can tell us what the body's trying to do or what
Oh,
the body's trying to achieve.
Of course, of course. No, that is so important and a great way to explain it. Thank you so much, Dr. Bryn. Now, when we talk, I often kind of go back and ask maybe the question, it's similar because sometimes ladies, they hear it differently. So I'm going to come back
Yeah.
around because I just love health esteem. So my question to you is, how does iron deficiency tie into health esteem? And why do you think it's so often missed? That's iron deficiency.
Mhm.
And how do you tie that into the health
Health esteem.
esteem that you've coined, which
Yeah.
I love?
Yes.
Dr. Bryn, health esteem. Don't forget, ladies, it's a very, very important foundation for us.
Well, I think number one, health esteem is about taking care of ourselves. So a few things, getting our annual blood work, and especially getting
Okay.
blood work when we have symptoms, having a healthcare professional that you trust, and having blood work when you're having symptoms. So when you are fatigued, run down, tired, making sure you do that. I'm sure this has happened to you. I've had this happen to me. We keep putting ourselves in a back burner, right? And the fatigue and these symptoms go on. But the starting block is we need to go for blood tests.
Yes.
And it actually feels really good when you do go and finally take yourself in, because really you're taking care of yourself, and someone else is saying, okay, what's going on? Let's do a whole inventory.
Yes.
So putting that together with health esteem is remembering to take care of yourself and don't deny or push away symptoms of fatigue or, hair loss or restless legs, things that are new or different for you.
Yes.
And also remembering you want to have access to your health information and labs. You want to be able to know once you do your blood work, oh, I want to go look up what is my hemoglobin, what is my ferritin, and then you want to track it over time, because patterns, I always tell people, a one-off is a one-off. We want patterns over time.
Right, of course.
To see and know, okay, my ferritin was low, or maybe, I've never really had a ferritin issue until recently. So having mindfulness on our health and testing. I think you had another question there that I didn't touch on.
Yes, absolutely. But before I go to the other question, something that you said about health esteem that I really want to drive home to the ladies, if you don't mind, Dr. Bryn, is what I'm hearing you say about health esteem is a part of it is really us girls, us ladies, taking control of our own lives, our own health.
Yes.
Because you're saying, Genevieve, go and get the numbers, but then keep track of it. Look for patterns. Don't just rely on the medical system or your primary care practitioner, because everything is busy, and we can actually be in control of that. So that's a really foundational part of health esteem, isn't it?
Definitely.
Dr. Bryn? I love that.
Personal responsibility.
Yes.
I like to call it.
Yes,
okay,
exactly.
I've got to check in with myself. I've got to be cognizant of my symptoms, book an appointment, get my blood work, and then know where am I going to, save it or track it? Where's my folder going to be?
Excellent. Thank you so much. And so my question was now going to go into iron specifically. We touched on FERAPRO, and you mentioned that you have used it specifically. How did you find FERAPRO iron for yourself? How did you come upon that, having all this iron at your disposal?
Oh, it's hard to remember back.
Sorry.
No, I love it. It's a great question. I can't believe how time has flown, because it was when I was at Chi Medical Clinic when I first started working.
Yes.
And 2015, 16, and 17. And I met Cal Rahimi there, who was representing Pure Pharmacy.
Yes.
And he would bring me really helpful information on hormone prescriptions, compounding hormones. And of course, their iron was part of it. Women's health support.
Yes.
And he said, Bryn, we've got this product, this FERAPRO. Have you tried it? And I thought, oh, no, I haven't. And I don't think I said it, but in the past I thought I've tried iron supplements and they were horrible. But lo and behold, literally, I started prescribing it and patients were getting results. Their iron was actually coming up and it was tolerable. And by that point, I had used a little bit myself. And also I noticed it was just way more pleasant to take. It didn't have the side effects.
Excellent.
And it worked. And so since then, it's like my go-to.
Excellent. Excellent. Thank you so much for that, Dr. Bryn. And again, what we talked about is, you mentioned that a lot of women, sometimes they've tried iron and it's just like, I'm not doing that again. That was horrible because of the stomach upset and constipation. And with FERAPRO, we don't have that. Now, I have a question from your clinical viewpoint. So FERAPRO comes in 3 different strengths, 30, 75, and 150. How would you, as a primary care practitioner, how do you decide what you prescribe for your patients?
The first question I ask is, would you describe yourself as a sensitive person to medications, food, supplements? And women who are sensitive intuitively know that, or they figured that out for their body. I did it about age 40. And when women know they're sensitive, I'll always start them on the lower dose of anything.
Okay.
Just to see how they feel.
Right.
But if women say, oh, no, I'm fine, I can usually start on a regular dose of anything, and I'm not super sensitive, then I'll start on 150 milligram. I mean, this is assuming their iron is below 15 or ferritin. Pardon me, their ferritin. It also depends where we're starting. If we're starting at 30 or 40,
sure,
and it will depend how severe their symptoms are.
Yes,
as well.
Yes,
it's like how much are they struggling, and we won't always know what % of the fatigue is from the iron deficiency. I mean, all their symptoms could totally clear up by the time their ferritin is up to 80. Or there could be other things we're treating.
Of course.
Thyroid or just other areas of their life. They're doing way too much.
Of course.
Needing to slow down.
Yes.
So it's a combination of how extreme their symptoms are, how their quality of life is impaired, for sure how sensitive their bodies are and what they tell me.
Excellent.
I'll ask. And I'll tell them, we always say start low and go slow. You can always give more.
I like that.
Right? So
Yes.
you can always give more.
Yes.
Or
course.
if they buy a larger dose, they can take it every other day.
Yes.
There's always ways to be creative.
Of course. No,
Yeah.
I love that. And one thing that I love that catchphrase. Again, Dr. Bryn, you have amazing catchphrases where we can start slow, start low, and go slow.
Yeah.
And especially with iron. And what we always say here in Walk with Wisdom is contact your primary care practitioner. Well, the amazing Dr. Bryn Hyndman is here, and she is going to be more accessible. You're going to have to let us know
I will.
To the rest of us so we can get this incredible information. And I'm really, really grateful that is where you're taking your practice with your long-term one-on-one, but really getting it out there in community for us ladies. I love it.
Thank you.
Yes, of course, Dr. Bryn. Now, the podcast has been a lot around perimenopause and menopausal women. And iron, of course, we talked about across the stages. How soon should a young lady start to supplement with iron? Is there a marker, or is it strictly dependent on blood tests and how she's feeling?
Guidelines do not, it's not suggested that we have routine blood tests, let's say in adolescence. Okay. Or in our 20s. Usually it would mean an adolescent teenager or a woman in her 20s would say, I'm tired, I'm run down, I'm getting sick a lot. Recurrent infections can be a sign of iron deficiency. Usually symptoms will start and then they will go to a primary care provider or their healthcare professional, and then blood tests will be ordered. So it's not a routine test.
I see.
But it's not uncommon between athletes, really athletic teenagers and young women. More maybe plant-based diets or vegan diets.
Yes.
More dieting, more food restriction.
Yes.
I think. And of course, there can be absorption issues and or genetic, which I did mention. Sometimes we do see it run in families.
Of course.
Where we don't have, there's no, risk factors or obvious factors. But women will say, my mom had it, I have it, and my daughter is susceptible. We always keep an eye on our iron, ferritin.
Oh, excellent. That's very, very well said, Dr. Bryn. Now, on the other end of the spectrum, why would the perimenopausal woman need to supplement with iron? Because I'm hearing from what I'm hearing out there from you ladies, because they send me the emails, or just from what we've talked about on the podcast, perimenopausal woman is almost like a forgotten group. But why would a perimenopausal woman be one to look at her ferritin levels? Can you mention some symptoms that happens around that stage of life that can make you prone to low iron and you're needing to supplement?
Well, these symptoms overlap. Big time. So iron deficiency anemia, perimenopause.
Yes.
Big time. Fatigue, brain fog, kind of
confusing.
overwhelming and exhaustion.
Gosh,
restless legs.
Yes.
Right? So and these can be vague or non-specific symptoms.
Yes.
But also in perimenopause, remember, we can have heavier periods.
Yes.
Heavier bleeding. So that's a source of blood loss or increased blood loss. So, and especially if a woman has fibroids, they could grow more because estrogen goes up before it goes down. The ovaries are really trying to have one last hurrah. There can be times to be elevated estrogen. So a woman might have fibroids and not even know, or they're tiny, but then they grow.
Yes.
And then she has more bleeding as well. So there's so many factors in our 40s during hormone change that could drive down ferritin levels.
Of course. No, that's interesting. And of course, we talked about me being a menopausal woman and thinking, so one thing I will say, some myths about low iron, and is it that you've seen in your practice or just in general, once a woman stops bleeding, her period, you're done,
Mhm.
then you don't have to worry about your iron levels at all. But have you noticed that in your practice? I could be a one-off, but does a woman always have to check her iron levels across her lifespan?
I do, because again, ferritin can be a marker of inflammation. It can be raised. I don't want to see it too high.
Of
So I'm not worried about iron
course.
deficiency, but I'm worried about what's going on in the body.
Sure.
But the part two is around age 65, even lower, we know that our stomach acid goes down. Our stomach is acidic. It has to be acidic. But our hydrochloric acid, like the acidity of our stomach, decreases in mid 60s onwards. So that means we absorb less,
Mm-hmm.
which means our iron absorption can go down.
Of course.
So, and especially if women are eating less meat or eating less, period. They're
Yes.
just not as active.
Yes.
I always check ferritin. That's all I can say. I always check it. And it will not be the same week to week. Things can take it up or down.
Of
So again, we
course.
want to see the trend, but it's also a red flag in a postmenopausal woman or a male if iron is low. We need to make sure there's not blood loss, like from a colon cancer.
That, of course, totally
So-
makes sense. Totally makes sense. Dr. Bryn, this has been such a fascinating discussion about iron. But really, the foundation that I think that you brought to the talk of iron today is health esteem. If there is one thing for women listening today, they may be feeling overwhelmed by the information.
Yeah.
What is one thing that they could take away? And I really want you to tie it into the
Yeah.
context of health esteem for me, because I will never forget that. I love it. So
Yeah.
yes, Dr. Bryn, what is one thing? Or it may be, a combination of things, because a lot of time life is not just a one-off. So yes, if they're listening, they're going, oh, Dr. Bryn, I don't know where to start. How would they start, and how do we tie it into health esteem?
Well, I love that question. You can start with asking yourself, what have I done to take care of myself today? And it doesn't need to be massive. Like, I'm not talking about a 60-minute boot camp workout in the morning.
Yes.
It could be just a ritual of 5 minutes on your own with a cup of tea, setting some intentions, just to slow down or a pause. It could be making a really healthy meal. It could be a connection. Like, what for you is taking care of yourself and nurturing yourself. And it's different for all of us.
Of course.
But number two, do your annual blood work. And what ties into that is have a healthcare professional or primary care provider
Yes.
that you know, like, and trust. And if you don't have one, it takes some effort, but make sure you find one, because that's a huge peace of mind. And it can be a medical doctor. It can be a naturopathic doctor. It can be a physician's assistant. It can be a nurse practitioner. So
Exactly.
there's lots of options, but really ensure you have someone you can go to
Excellent.
and get blood and have your annual blood tests.
Excellent. Dr. Bryn, thank you so much for that. And always at Walk with Wisdom, we say, go to your primary care practitioner. It's important, especially for your iron levels, because as you say, we don't want to guess.
No.
And getting that test, to me, after talking to you, understanding health esteem and what it means, that's really foundational for us to have some real numbers and then build out our responsibility for our own health from there. Dr. Bryn, thank you so much for joining us today. I may knock on your door again.
Absolutely.
To come back.
It's been a pleasure.
It's been an amazing pleasure.
There's one thing I'll tie in as a
Yes.
last point. You said, how does iron deficiency anemia tie in with health esteem?
Yes.
Well, the thing is, if we're really tired and bottomed out and burned out and tired, it's really hard to take care of ourselves.
Oh, so true.
So that's how it ties in. And if a main cause of being fatigued is that you're deficient in iron, you can resupplement iron. So
Excellent.
it's a reminder, like, we do need energy to take care of ourselves.
Excellent.
And if iron deficiency is one of those causes, it's treatable.
Absolutely. No, that's amazing. And I'm so glad that we touched on the different types of iron. Women,
Yeah.
don't be afraid of iron. You heard from Dr. Bryn, just really what makes iron easier to absorb. Not what you take, it's what you absorb. FERAPRO has those cofactors. And so, Dr. Bryn, you've been amazing. Thank you for being so transparent about your life, your journey.
Yes.
and health esteem for women.
Of course. Thank you so much for having me.
Thank you.